One of the most important things we can do as healthcare professionals is to keep ourselves safe from each other and of our customers. It all starts with a mask and how to properly put on a mask. So today I'm here with my colleague, Dr. Ira Zuna, and we're going to talk about the proper way to fit a mask and put on a mask.
Masks are incredibly important, and there's two main types. Of course, there's cloth masks. But when you really look at these N95s or M95s, they'll either have a valve or they won't. And the ones with the valve are good because they let heat out. But if you have the virus yourself, they also let the virus out, and you can infect others. These are helpful if you do have the virus. They prevent others from getting it better than the one with the valve, but they are warmer. So if you're trying to avoid contracting the virus, this is going to keep you cooler. The other really important thing is when you take them off, you have to consider the inside and the outside to be contaminated. This can be the best way to give somebody else COVID. Absolutely. By leaving your mask in the wrong place, letting somebody else touch it. The key to taking off a mask is to grab it from the side, from the periphery, and slowly pull it off over your head. You want to make sure not to touch your nose or your eyes as you take it off. And you want to ideally pull it from the straps or from the edge so that you don't get COVID that may be sitting on the mask then onto your hands. Also, it's important if you reuse the mask to disinfect it properly. Hydrogen peroxide, isopropyl alcohol, there are a number of other sprays and agents, but you want to make sure that you kill the germs that are sitting on your mask before you use it again. And above all, make sure that you don't give anybody COVID by letting them come in contact with the used mask. Well, how do we get COVID? Now, what are the different ways we can get it? Remember, if you just touch something and your skin is normal and healthy and not cut or cracked, you're not going to get COVID through normal, healthy skin. How you can get it is either by breathing it in when it's in the air, and it can be in the air for up to several hours, and it can travel up to 27 feet if somebody has a big sneeze that has COVID. But you have to breathe it in through your nose or your mouth, or for respiratory droplets to touch your eyes in order to contract the illness. The other way to do it, aside from getting it from the air, is touching something that's been contaminated. And depending upon the surface, the COVID virus will stay alive between up to 4 days. Particularly on plastic, it's the longest it can stay alive is on plastic. But if somebody touches their eye, touches a table, walks away, the next day you touch the table and touch your eye, you can get it that way too. Tables, all those common surfaces, handrails, pens to sign at the checkout counter, doorknobs, anything that we all touch, elevator buttons.
So what we do here at the drugstore is we wash our hands prior to putting on the mask. Once we put the mask on, we wash our hands again, always washing our hands multiple times throughout the day. You take the mask off, don't put it on the table, put it somewhere because it's contaminated. Once again, wash your hands. Always wash your hands.
Be safe and well.
Stay healthy. Have a nice day. And thank you. And keep this in mind when you're looking for 90-degree elbows, large and small. I recently remodeled the hardware and doubled the inventory.